An artificial airway is a tube that is inserted into the patient's trachea in order to maintain breathing and ventilation. We created this video to cover the medical definition and provide a brief overview of this topic. So if you're ready, let's get into it. Airway management is the process of maintaining ventilation so that gas exchange can occur. This allows a patient to take in oxygen while removing carbon dioxide. This is important because we need to keep a patient's upper airway free and clear of foreign substances so that air can flow into and out of the lungs. And one very important aspect of airway management involves the use of artificial airways. As previously mentioned, an artificial airway is a tube that is inserted into the patient's trachea in order to maintain breathing and ventilation. This is necessary when a patient is unable to maintain their own airway or if they are at risk of aspirating. In this case, an artificial airway is used to establish a link between the patient and the mechanical ventilator. There are three primary types of artificial airways that you need to be familiar with: endotracheal tubes, tracheostomy tubes, and pharyngeal airways. Each type has different uses and advantages. However, in order to function properly, they must be inserted and maintained correctly, which is the job of the respiratory therapist. An endotracheal tube is a small flexible tube that is inserted through the nose or mouth into the trachea. This is necessary to establish an artificial airway for a patient in need of mechanical ventilation. The endotracheal tube is secured in place with tape or a tying device, and the insertion process is known as intubation. A tracheostomy tube is a small flexible tube that is inserted through an incision in the neck and into the trachea. This is generally done when a patient is unable to tolerate intubation or if they are in need of long-term ventilatory support. After a tracheostomy tube has been inserted, it is the responsibility of the respiratory therapist to maintain the tube in place and keep the incision site clean. This is known as tracheostomy care. And then we have pharyngeal airways, which are small tubes used to prevent obstructions, and they extend only into the patient's pharynx. There are two types to be familiar with: nasopharyngeal and oropharyngeal airways. A nasopharyngeal airway is a small tube that is inserted into the nasal passage of patients who require frequent nasotracheal suction. An oropharyngeal airway is a small tube that is inserted into the mouth of an unconscious patient to prevent the tongue from causing an obstruction. A key tidbit to remember about these airways is that the oropharyngeal airway can only be used if the patient is unconscious. If the patient is conscious with an intact gag reflex, an oropharyngeal airway would be contraindicated. But again, for this video, we just wanted to provide you with a brief overview of the most common types of artificial airways. We have separate videos on our channel that go into more detail of each type if you want to learn more. But real quick, if you don't mind, hit the like button to support the channel. I really do appreciate it. And be sure to subscribe for more videos like this. And just a final reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always,